Welcome. I'm Mitch Jelniker from Hope with Answers. While we recharge and plan ahead, we're sharing your favorite episodes. Today's most listened to episode of 2024 explores palliative care in lung cancer. Dr. Sherry Cervantes and patient Sally Kane discuss how it improves quality of life. So join us as we uncover the potential of palliative care in lung cancer treatment. Welcome to another edition of Lung Cancer Foundation of America's Hope with Answers podcast. Today, we're going to delve into palliative care and its profound impact on the quality of life for those navigating living with lung cancer.
This is a holistic and a compassionate form of care designed to alleviate all types of suffering, whether or not it's associated with lung cancer treatment. Think of it as a team of medical professionals who are focusing on providing relief for symptoms, pain, and stress.
So we'll begin with Dr. Sherry Cervantes. She's the Director of Palliative Oncology at the University of Texas Health San Antonio MD Anderson Cancer Center.
Dr. Cervantes, how do you define palliative care?
Yeah, that's a great question. I think a lot of people are confused about what palliative care is and what it means. For my patients, I really try to express to them that palliative care is about making you be as functional as possible for as long as possible. And we really focus on symptom support and control. We focus on what's valuable to a patient, what gives them meaning and drive and motivates them. And we try to incorporate those things into their medical management and plan. So palliative care is really focused on patient-centric things and how do we help make you feel the best for the longest as you're going through critical illness care.
About quality of life, essentially. So sometimes when people hear the word palliative care, they confuse it with hospice care, but they're not really the same, are they?
Right. So they're actually sort of an overlap between palliative care and hospice care, but they're definitely distinct entities. Okay. Most palliative care physicians now go through a training, a fellowship program. And part of that training teaches us how to both care for people as they're diagnosed with critical illness. So how do we take care of their symptoms? How do we help learn about them and prioritize their goals through the end of life? And so a small portion of palliative care is hospice care, but hospice care is not all that palliative care is. So palliative care can be any time throughout the duration of an illness, whereas hospice care is usually closer to the end of life.
Let me make sure that I've got this right. I want to know who exactly should be considering palliative care and when, but is it more of a life-limiting illness? Is it impact when your illness is impacting the quality of your life? Is that how we should think about it?
Yeah, so it's both is what I would say to that question. And one of the key things for palliative care services are that the anticipated course of an illness would be life-limiting, okay? Because oftentimes those have a lot of psychosocial distress or symptom burden associated with them. And that's what we focus on. That's what a palliative care team would help care for. Whereas, the functionality and the quality of life is one of our goals, one of our priorities. Patients that have maybe chronic illnesses that may not be life-limiting wouldn't be the ideal patient to receive palliative care services. So we certainly focus on that for patients who have these critical illnesses. But there's only so much that we have the capacity to do in palliative care, and there's a lot of patients with these illnesses that we try to help support.
So I want to follow up. So if you have someone who has lung cancer, would you most likely be thinking of people who are at stage 4, or is it more impacted by the symptoms that they're having?
Yeah, so another great question. And I think this is where a lot of people get confused about palliative care. So even in early stage cancers, there's a potential that could be a life-limiting illness, okay? And so patients that come in with high symptom burden, so specifically for lung cancers, maybe they have an airway obstruction or something like that, and they're short of breath or they're having chest pain, those would be patients that are appropriate to see palliative care, even if they're planning to undergo curative treatment, so surgery or radiation and chemotherapy. Those are patients we can still assist with and help with. And it may not be that we follow you indefinitely. You might graduate from palliative care services once you complete your treatment. So, there's sort of a spectrum to what we do, but especially in cancer care, the earlier the better, I think. And the more symptoms you have, the more helpful we can be through your treatment course and helping you be successful in that treatment course.
It sounds like palliative care would offer great comfort to the patient. So how does it work exactly?
Yeah, so with palliative care, oftentimes we're notified by the oncologist, or if a patient is hospitalized, by maybe the nurse, that a patient would be appropriate for us to see. The most common way people are referred to palliative care services would be on an inpatient basis. So you're hospitalized for some reason, you're hospitalized to provide symptom relief, or you're needing to have a surgery. Potentially you're being diagnosed with your cancer, and palliative care would be called in by your team to come and help with manage symptoms. Okay. Occasionally there are outpatient structures for palliative care medicine, and that is growing. So more and more systems have outpatient or ambulatory palliative care services. And so now oncologists can refer directly. The other way that sometimes people get engaged with palliative care services is they have a family member, or they have a personal experience with palliative care services. And so once they find out about their diagnosis, they ask their physician, hey, I'd really like to see palliative care. I think it would be helpful for me.
This is fascinating. Do you have like stages in palliative care?
So sort of a difficult question. We don't formally say that there are stages for palliative care, but we try to meet patients wherever they are. Okay, so on the inpatient side, palliative care can be involved as a consultative services. There are some hospital systems that actually have inpatient units for palliative care. And so you might, consider that as like a phase or a stage. The outpatient setting, there's both clinic-based palliative care services as well as home-based palliative care services. So there again, just trying to meet patients where they are. How can we be the most useful and helpful to patients and their families? And then, that last portion, or sort of the next phase of palliative care, is really that transition to hospice. Okay. Again, it's included in our palliative care training. It's considered palliative care in a sense, but it's really reserved more for people who we think are closer to the end of life.
You mentioned at-home services, also outpatient services. Give me an example of the kinds of services that might be included with palliative care.
So most palliative care programs are designed to be an interdisciplinary team. So it's not just you walk in and you meet with the physician. The hope and the design of palliative care is to be able to care for the whole person in one place. And so you'll have access to the social worker, the chaplain, the nurse, sometimes physical therapy or occupational therapy. Most of the time, some type of psychosocial support with a psychologist or psychiatrist. So we're really trying to care for the whole person all at the same time. It's a team-based approach. So, the expectation when you come to meet with us is that we're going to be there for you to listen to what's going on, to try and really get to know you, to try and really get to know your family, and how does that impact your care choices or your decisions that you might be making.
So are all palliative care services basically the same? I mean, what questions should you ask, and what should you be prepared for when you have your first consultation?
So I would say Most often people come into the palliative care office, especially if they're referred from their oncologist, and they really don't have an understanding of why they're there. Okay. You ask, what do you know? Why did your oncologist, why did your cancer doctor send you over to see us? And they go, I don't know. And there's sort of this pause. And so we will commonly go, well, that's okay. Most people don't really know what palliative care is and how we can help. So let me describe a little bit for you and talk to you about how we might be able to assist you as you're going through your cancer care. And so we talk a little bit about what resources are available to them as far as our team members. So we do an introduction. So you should anticipate that you're going to meet the team. Okay. We also do sort of a full assessment of what is your symptom, what are other symptoms that you might have, what are your worries or concerns, what questions do you have, what's your understanding of your illness or your treatment, and really try to learn more about them. Okay, so typically you can anticipate that these appointments are longer. Most of the time, the first time you meet one of your doctors, it's maybe a 20 to 30-minute visit, if that. For our new patients, most commonly, they're somewhere around 45 minutes to an hour and a half. So they're pretty long visits, and that's because we need to get to know you to be able to help care for you moving forward.
Yeah, so prepare for some time, and that you need to take the time so you get to know the team and they get to know you and what you're going through. So can you seek, as a patient, can you seek out palliative care on your own, or must it be recommended by a doctor?
No, absolutely. You can be referred by anybody, including self-referral.
Okay.
So we certainly encourage that, especially for the lung cancer patients. We know that palliative care can be very impactful in lung cancer diagnosis, almost as impactful as a treatment line. The initial, palliative care study that really brought palliative care to the forefront, especially in cancer patients, was the TEML study. And in that study, they looked at patients who were diagnosed with advanced stage lung cancer, who received early palliative care, so at the time of their diagnosis, versus patients who received standard oncologic care. And there was a 3-month improvement in overall survival. That's as good as a line of chemotherapy.
Wow.
So that's really impressive. And one of the reasons why we encourage people, if you find out that you have a cancer diagnosis and you want to talk to us, let your doctor know. Tell them you want to go see palliative care, and we're happy to see you.
That's great.
This is great. 3 months. That is outstanding. So is this covered by insurance?
So yes, most insurances cover palliative care services. And, there is sometimes a distinction between the palliative care services and hospice services. And so that's why I say most of them cover it, because they sometimes have some different coverage for hospice services. But pretty universally, insurance companies will cover it. And one of the reasons is because it's holistic. It's looking at, caring for the whole patient, looking at all of these different things and trying to connect them with appropriate resources and supports. And as much as we can do to help keep people functional and help keep them out of the hospitals, the insurance companies really like that. So they cover the palliative care services.
And I'm gathering that there are really no bad questions here. In other words, I can picture a lung cancer patient thinking, well, my legs hurt, but I don't want to bother my oncologist with it. But you could share that with a palliative care team. They might have some things that would make your life easier.
Absolutely. And I always encourage our patients to do that. We tell them that we partner and we're going to team with your oncologist, but we're here to talk about the things that maybe you feel you can't share with them, or you're not ready to share with them, or you didn't have time to. Okay. And so sometimes we just are a safe space, and it could be that, they're discussing a change in treatment plan, but they didn't really understand what their oncologist or their radiation doctor explained to them. And so we have a chance to sit down and explore it a bit more, maybe talk to them about it, and explain what does it mean for them, what does that look like. and really just help ease their mind about what are the things that are being offered to them, and is it in line with what they want for themselves.
And if you had a lung cancer patient, are there any special considerations that a lung cancer patient might come to you with? Whether it's coughing all the time or the stigma issue of the self-blame because I was a smoker, or those types of things. Are those handled in palliative care as well?
Absolutely, and those are really great points. For the different disease processes, we might focus on different things, but the common things that we see in lung cancer patients would be concern about their cough, sometimes chest pain. The other thing that we see is their fear of shortness of breath, their fear of air hunger. And so we do spend a lot of time talking to our lung cancer patients about how do we help manage shortness of breath or cough. We also spend quite a bit of time helping with the stigma of smoking, and cancer patients with never smoking history. Sometimes they feel this guilt, associated with it because there's this long history of that association.
Dr. Cervantes, how many patients use palliative care? Is it well known? Is it underused? Where are we with this?
I think the most direct answer to that is it's underutilized. I think that because of the association and stigma with hospice services, that people don't utilize the full extent of palliative care early enough. And so that's one of the big efforts of the palliative care field, is to really help people understand, help educate both providers and patients and the community about what services are available. I can speak from our experience in our cancer center here. Unfortunately, less than 1% of patients get referred to palliative care, and that's in any cancer group. And so you can imagine in cancers that maybe are less common, fewer people get referred. I am a huge advocate for palliative care as an oncologist. Most of my patients get referred probably earlier than most. But I think from the standpoint of understanding what it is and being able to educate the community, sessions like this are so vital and critical to helping people understand what we can do. It really does help people live longer.
It's fascinating. Are there areas that we didn't ask you about that you would like to share more about?
I just think the value of palliative care is so misunderstood. I think most people only come across it or introduced to it in an inpatient setting, very late in a disease illness course. And so we're not able to have the impact that we should be able to have on patients with lung cancer. And so when we talk about how many people are referred or how many people receive services, some of it's actually limited by the number of palliative care teams and the number of palliative care providers that are available in that region. So, I think if you have access to it, utilize it. I can't stress enough how helpful it can be, not just for patients, but also for their family members. We didn't really talk about like caregiver burden and the distress that loved ones and family members might experience as their family members going through cancer care. But that's another aspect of palliative care that we try and dig into and try to help support so that the patient can feel better and get the best care.
Dr. Cervantes, is excellent information. Thank you for sharing your expertise. We appreciate you today.
Absolutely. Thank you so much.
I love Dr. Cervantes' quote that palliative care is really supportive care. Palliative care is a team of medical experts providing added support that is available at any stage of illness.
And it's not only about the patient's comfort. Palliative care can help patients be successful in their lung cancer treatment. So now let's hear from someone who's actually experiencing palliative care. Sally Kane is living with stage 4 lung cancer, and she is one of Dr. Cervantes' patients. Hi, Sally. It's so nice to meet you. I am very interested in your lung cancer story. Tell me about it.
It just happened out of nowhere. I had an ache on my right side, and this was last May of 2023, and I got up the next day and drove myself to the emergency room, and they thought it was a kidney stone. And when none of the drugs helped that they gave me, they did a CAT scan of my lung, and then the doctor came in and told me what they had found. And they did a bronchoscopy, where they go down through the trachea and into the lung, into both lungs. And after that was over, Dr. Hines came and told my family that I had stage 4 lung cancer, and it had metastasized to my spine and to my brain, and that I didn't have very long to live. My team of doctors, and one of them being Dr. Cervantes in palliative care, have just been amazing support. And I can't imagine going through this without my monthly meetings with Dr. Cervantes and her nurses.
Yeah.
They're excellent, and it's not that you're giving up. I think my husband was diagnosed with gastric cancer, and he did not have palliative care for the last 7 months that he was alive, and it just I'm so sorry that we didn't have it. We should have, but things move so quickly. But my daughter really encouraged me about this, and certainly Dr. Taverna, hooked me right up. And so I'm just eternally grateful for all the things that they do and have done and helped me with through this journey.
That's fantastic. A lot of people don't exactly know what palliative care is, and sometimes they can confuse it with hospice care.
Yes.
Tell
Yes.
me why you chose to go this route. What was it about palliative care that appealed to you?
Well, it was explained to me by my medical daughter. She said, "Mom, this is where you go for every other little thing that's bothering you, because Dr. Taberna is just looking at your cancer in the lung and the base of the brain and on the spine. The pulmonologist, Dr. Habib, is just looking at the lungs. Dr. Oshiri is just concentrating on heart and cancer and muscle mass. And then I go for IV infusions for Fosamax to strengthen my spine. And this palliative care, you go for all the other symptoms and ailments that you have that are not related to any of those other doctors on the team. And it's been wonderful. And I can give you a couple of examples.
Great.
I had a really bad cold during Christmas, and my back started hurting, and it sort of felt like every time I coughed, it felt sort of like the pain, like on my side when they first diagnosed me with lung cancer. And I didn't tell anybody, but then I had an appointment with the palliative care team, and I told them about this because they noticed that I was coughing quite a bit. And I said, "Well, I'm supposed to have a PET scan in about 6 weeks, a month to 6 weeks." And they said, "Why would we wait for that? You're worried." And I said, "Yes, I'm worried.
Yeah.
I'm terrified." She said, "We're going to go right downstairs and have an x-ray of your lungs. We're going to check if they're inflamed, and maybe this is just muscular," which that's what it was. So that that alleviated that fear. Because I really didn't know. I mean, I didn't know who else to turn to, because I know Dr. Taverna is very busy in research 4 days a week and clinic on Fridays, but this was something that I just kept to myself because I didn't want to go there. I don't know how else to explain it. I didn't want to think that the cancer had spread. Um, but and then there was another time I had real problems with my right ear, and I collapsed when I was at physical therapy. That's another referral that I got from palliative care, because I'm a bit wobbly. I've lost about 30 pounds, and I've lost a lot of muscle mass. And so when I went for the evaluation several weeks ago, um, I lost my equilibrium and collapsed. And so palliative care, they've hooked me up with an ENT who will eventually send me to an audiologist, I would think, to check my hearing. But Dr. Cervantes said that possibly when they did the radiation at the base of my brain, that sometimes that messes up the eustachian tube. So so that made me feel a little better, because there's something going on in there. I don't know what it is, a pulsing or a rush or a wave, listening to waves or whatever. So these are things that I could talk to palliative care about that I wouldn't know who else to talk to. So they've been a great help.
It seems to me that what you're talking about is that these people kind of surrounded you with support and gave you the opportunity to talk about the other issues that maybe you wouldn't have talked to your doctor about because you're thinking it's not the same thing that they're interested in, they're too busy, whatever. Is that true? Is that what you would tell a patient?
Yes, I would, because some of the meetings with Dr. Taverna are about 30 minutes, but with palliative care, you have an hour, up to an hour and a half, sometimes 2 hours. And the I had an issue with my nails. Tagrisso, this immunotherapy drug I'm on, apparently uh, does something to your nails, and they split all the way down to the quick. And it's not, I mean, it's a small price to pay for being on a drug that kills active cancer cells, and certainly takes the inflammation away from the main mass. And the spot on the base of my brain has gone from 4 millimeters to 2 millimeters. But palliative care has made a difference in my life, and I'm just so sorry that my husband didn't have that support, because the team, it's all of them, the oncologist, the palliative care, Dr. Cervantes, Dr. Habib, my pulmonologist, because I had to have another bronchoscopy because they were afraid that I had pneumonitis. And if that was the case, I'd have to get off of Tagrisso. So I worried about that. And then Dr. Ocheri has just done a workup on my heart. And we visited with the orthopedic, because I have a cracked rib also in that same area where they found the original cancer. And Dr. Taverna thought maybe they needed to put cement there, and they decided not to, because it's not hurting as long as I don't pick up heavy things and make it worse. So I'm pleased that my daughter encouraged me to do palliative care. I just feel like there's hope. So maybe I'll get to see my granddaughter have her 5th birthday party, or but that's, I've had a lot of support from my daughter and son-in-law, and from my church. They just Father David came to see me in Austin right before I had the bronchoscopy, and then got the diagnosis. And the support it's a lot, and you need it. And I can't imagine people going through this without support. But the palliative care team has been just miraculous. I mean, because it was a nightmare when they tell you that you have lung cancer, and I look at them and go, I never smoked a cigarette ever in my life. And where did this come from? So it's environmental.
As we hear from so many people,
Yeah.
if you've got lungs, you could get lung
Lung
cancer. It
cancer.
can happen to anyone at any time.
Right.
I think an
Right.
excellent point, though, is you're living with lung cancer and your knee hurts or you've got an earache or your nails are splitting. Well, your family, while supportive, doesn't really know what to do. You feel kind of bad bothering your oncologist about it. Well, here's where the palliative team comes into
Comes
play.
in.
There may
Absolutely.
be something to it. And if nothing else, it offers a higher quality of life. They can, kind of soothe some of those things over. So if someone out there is considering palliative care,
Oh,
and they go,
absolutely.
you'd say, yes, I
Oh,
did. Yeah. And when they
wholeheartedly.
go in for their first consultation, what happens? What's kind of the exchange? What do they ask you?
Well, it's a long consultation. You have to fill out a form of everything that's bothering you physically and mentally. Um, and it takes a long time because they're just meeting you for the first time and they're getting to know you. And uh, um, it's uh, it's not easy. It's not easy talking about it to strangers.
Yeah.
I'll say that, and I think I probably cried the first time I was there because it just all of that just kind of brought back my husband's situation and losing him because we were so close. And but they handed me a tissue and we moved on. And that's what I needed. I needed them to say, okay, how do you feel? And what's been happening? You've lost weight, you've lost appetite, uh, your fingertips hurt. Uh, it's crazy things like that. But but they, are you dealing with financial issues? Do you have support at home? Um, do you have groups that, I used to belong to an exercise group, and I talked to the director. She came over to see me and she said, I just don't feel comfortable having you do what you normally did 5 years ago. And I appreciated that. So now I'm in physical therapy. So, and that palliative care took care of that. And I have 11 sessions coming up. So, but that first meeting, it's long, and bring your family, have your family members with you so they can hear you tell them how you feel, because they need to know how you feel. You know how they feel. They're sad, um, and upset, and because it doesn't make sense, because you look healthy, but you're not. And they need to remember that. And so the first session is tough, but after that, you'll get to know all the nurses and Dr. Cervantes and all of the different nurses, and they're wonderful. So I just cannot stress the importance of having palliative care. Um, Somebody in the palliative care team to help you through this. And it's not hospice.
No, it's not. I want to ask you about that. So I have one question. The first question is, how often do you see them? And then how do you see it as being very different from hospice?
I see them about every 6 weeks. If I'm having a good spell, maybe a little longer. Um, but I check in with them about that long, and so I know to get there an hour early so I can find a parking space. And I finally figured out exactly where I am and where I'm going in this maze of a building.
Yeah.
Hospice is completely different. They take over.
Right.
That's their job, and they bring in a bed and they bring in people to bathe you, and um, uh, they bring an ambulance to take you to your doctor's appointments. They're there to administer medicine or IVs. Bob was on IVs a lot, and it's not the same. It's not. You're not talking to a therapist. You're talking to a nurse that comes in to take care of you physically, and it's not a mental. I mean, it is. It's when you're on heavy narcotics for pain. It's a supportive for the person who's taking care of. Like it was supportive for me taking care of my husband that someone was there administering that medicine.
Right.
But palliative care is not that way. They all have smiles on their face and they're, how are we doing today? And it's just kind of a breath of fresh air. And I think that is, that says a lot through good times and bad times. I mean, you need that, uplifting support. You're a person too. I mean, you're not just a cancer victim. You're, I'm Sally.
You're living with lung cancer, which is a wonderful thing to be living with lung cancer.
My birthday is this month on the 17th. I'll be 70.
Happy birthday.
Yes, thank you. So
great advice for someone out there contemplating and just trying to figure out if palliative care is something for them.
Right. Just have the best team care as you possibly can. Because that makes you feel like there's hope. And that's what you want is hope to go on the next day. But thank you for giving me this opportunity. I appreciate it. And I just hope and pray that anybody who has lung cancer, that their journey is as positive as mine has been due to palliative care.
Good job.
That's lovely. Fantastic job.
Yes.
What struck me most during our conversations was that only about 1% of lung cancer patients are taking advantage of palliative care. And, we learned it can make such a difference during their lung cancer journey.
Absolutely. Most insurance plans cover it, and it is designed to provide comfort and relief for the patient. So for many living with lung cancer, palliative care is really worthy of exploring.
It really is. And if you're enjoying our Hope with Answers Living with Lung Cancer podcast, I hope you'll consider making a donation to help LCFA produce more of these types of resources.
And remember, this podcast is a resource for patients or anyone seeking answers, seeking hope, and access to updated treatment information, scientific investigation, and information about clinical trials.
Make sure to subscribe to the Hope with Answers Living with Lung Cancer podcast. You'll be notified every time a new episode is available. So visit us online at lcfamerica.org, where you can find more information about the latest in lung cancer research, new treatments, and more. You can also join the conversation with LCFA on Facebook, Twitter, and Instagram.